So thanks for taking the time for being here. We will see some results on our study using photobiomodulation in patients with dry AMD, in patients with early and intermediate AMD. So if you have any comments, if you have any question, just raise your hand and I will be happy to get your comments and questions. So we know that AMD is a leading cause of visual loss in patients older than 50 years, and the dry AMD is really common. Most of our patients with AMD are actually characterized by a dry AMD stage. Dry AMD may be also divided in different stages, including early and intermediate stages, and finally there is the late dry AMD stage, which is actually characterized by the presence of geographic atrophy. There are different risk factors for the development and the progression of AMD. Probably the most important is aging. Once one of our patients is affected by AMD, there are different visual changes that may affect our patients. Our patients may complain of a reduced visual acuity or metamorphopsia, which mainly affect those patients in the late stages of the disease. Usually patients in the early or intermediate stages do not complain any visual change, and that's the reason why some patients may be referred to our center late in the disease. One of the most important risk factors for the progression from intermediate to late AMD is the drusen volume. So if you have a patient with intermediate AMD, you may want to measure the drusen volume, as the higher is the drusen volume, the higher is the risk to develop late AMD over time. There are some treatments which were aimed to reduce the drusen volume, as again the drusen volume is an important risk factor for the progression from intermediate to late AMD. In our clinical setting, we may use some supplements for our patients with early or intermediate AMD. These supplements are effective in reducing the number of patients developing a late AMD over time. However, one of the main purpose of companies, of course, is to try to get new treatments available to avoid patients with early or intermediate AMD to developing late AMD. And these are the supplements we all know and we probably all use in our clinical setting. Again, there are different stages of AMD, and we really want to avoid early or intermediate AMD from developing late AMD, both geographic atrophy and the wet AMD stage. We did try to investigate a treatment based on photobiomodulation in patients with early or intermediate AMD in order to investigate if this treatment is safe, and also to understand if this treatment may be effective in reducing the progression from early or intermediate AMD to late AMD. Photobiomodulation is also known as low-level light therapy. This treatment uses different wavelengths from visible light to near-infrared light, and these lights are provided using this mask. This mask is able to produce different wavelengths which may eventually go into the eye, and there are several evidences suggesting that this kind of wavelengths may improve the mitochondrial function. There are also some evidences showing that AMD may be characterized by a reduced function of the mitochondria, and mitochondria are really important in both the RP cells and in photoreceptors. So this kind of treatment try to improve mitochondrial function, which again is important in RP cells and photoreceptors, And based on this assumption, the improvement in the function of these cells was thought to reduce the drusen volume and also the progression to late AMD. This was a multi-center study, an international multi-center study, and again, this is to just to again highlight that this kind of treatment may improve the mitochondrial function, and the yellow light we use in this treatment is also thought to reduce the level of VEGF, while the red light we use in this treatment is thought to also reduce inflammation. We know that the increase in VEGF levels and presence of inflammation are two key factors in the progression from intermediate to late AMD. This is again how the study was designed. Our patients were mainly affected by early or intermediate AMD, and this is how the treatment was done using this kind of mask. But I would like to highlight how the study was designed. We did perform a loading dose of treatment, which was based on 8 treatments over 1 month. Each treatment was 3 days after the previous treatment. So this was the loading dose of, again, 8 cycles of treatment, and then we repeated this treatment, which was based on 6 cycles. A loading dose of 8 cycles, we repeated 6 cycles. Preliminary results were just published. They were mainly focused on the safety of this treatment, as when we get a reduction in the drusen volume, this is not always a good thing, as sometimes a reduction in drusen volume may be associated with the development of geographic atrophy. So we wanted to understand if this treatment, even if we are able again to get a reduction in the drusen volume, was not associated with the development of late AMD. And we wanted also to investigate if this treatment might be associated with other safety issues. It was safe. We didn't experience any development of late AMD in our patients, and we enrolled 76 patients. We perform 152 treatments for all the eyes enrolled, and again, this treatment was safe, and we also got some very early results on the drusen volume and the visual acuity. We got some improvement in the visual acuity in those patients treated with this treatment, and also the drusen volume seems to be reduced after the treatment. Of course, these are only early data, early results. We need to get a longer follow-up. We need to increase our sample size, but at least this kind of results may motivate ourselves to continue study this treatment, which is again safe, and it seems to be effective. I want to show you a couple of clinical cases. This case was provided by Claudio Iovino, who is one of the co-investigators of this study. So this was a patient affected by intermediate AMD. You may appreciate some drusen as detected using structural OCT. This was after the loading dose of the treatment. You may appreciate the reduction in the drusen volume in the exactly same OCT scan of the same patient. Even in this B scan, you may appreciate the reduction in the drusen volume, and this is another B scan. Another important factor that must be highlighted is that even though we had a reduction in the drusen volume, we didn't note any increase in the reflectivity, which may be a very early sign of geographic atrophy development. So it seems that there is a reduction, at least in this patient, we did notice a reduction in drusen volume without the development of late AMD. This is another case. Also, this patient was characterized by some drusen, and after the treatment you may really appreciate the reduction in the number and also in the volume of these drusenoid detachments. So we keep working on this trial. We are very close to end up our 1 year follow-up, and hopefully we will be able to share the final results at the next EURETINA. I'm grateful for your attention, and I'm open to the discussion, and I'm open to get all your comments and questions. Thank you. So we do know that AMD may be characterized by some mitochondrial dysfunction. So mitochondrial function is important in RP cells and in photoreceptors, which are known to be affected in patients with AMD. So the aim of this therapy is to improve mitochondrial function in these cells, and in this way trying to improve the outcome of these patients. We got some preliminary results of our study, and these results show that this treatment is safe. We didn't experience any progression to late AMD in our patients. We didn't experience any problem, any main issue. So for sure, this kind of treatment is safe. As I mentioned previously, we got some preliminary results of our study using photobiomodulation in patients with dry AMD. We also noticed some interesting preliminary results regarding changes in drusen volume and visual acuity. It seems that after the treatment there is a reduction in drusen volume without the development of late AMD, without the development of geographic atrophy, and also the improvement in visual acuity seems to be higher in those patients treated with this therapy. These results are going to motivate ourselves to continue to study this kind of treatment.